The primary objective of the healing process is to fill the gap created by tissue destruction and restore the structural continuity of the injured part. Wound healing is commonly divided into three phases: the inflammatory phase, the proliferative phase, and the remodeling phase. During the inflammatory phase, inflammation aims primarily at removing the injury-causing agent and limiting the extent of tissue damage as it prepares the wound environment for healing. Inflammation is manifested by redness, swelling, heat, pain, and loss of function. The phase begins when smaller blood vessels near the site of injury constrict briefly before they expand. Then the vessels dilate, promoting congestion. An accompanying increase in capillary permeability leads to the movement of fluid into the affected tissue. Increasing viscosity causes the blood to flow more slowly, and clotting occurs. Phagocytic white blood cells, or leukocytes, emigrate through the vessel walls into the inflamed tissue, where the leukocytes engulf and degrade the bacteria and cellular debris in a process called phagocytosis. Phagocytosis is part of the immune mechanism to prevent an infection that would impair wound healing. Subsequently, growth factors are released, leading to the second phase of wound healing, the proliferative phase. During the proliferative phase, the focus moves to the building of new tissue to fill the wound space. The third phase of wound healing is the remodeling phase. It begins after about 3 weeks and can continue for 6 months or longer. During this phase, scar tissue is being formed. Scar tissue may achieve 70 to 80% of tensile strength by the end of 3 months. Wound healing consists of filling the gap created by tissue destruction, followed by restoration of the structural continuity of the injured part through 3 phases of healing: the inflammatory phase, the proliferative phase, and the remodeling phase.